Hey fam, Alina here with Iron Health. We are a community that raises the standard of health and wellness at Iron Health. This is Joe, and today we're going to be talking about staying active over 40, why that's important. We have a lot of our patients are over the age of 40, and that's because at around that age, our bodies start to break down. Why is that?
A big factor when you're over 40, your tendon strength isn't as strong. Um, it depends on the sex too. So, like, let's take men for example. This is like just one specific thing, but like men's shoulders, rotator cuff tears happen usually when they're above 40 because what happens in their 20s, they start to wear down their shoulder, whether it's through something they're picking up, they're in the gym, or something basic. Maybe they were in a sport, but the pain's there and then it goes away and they don't take care of it, but it's still there, right? And it's lingering. And then in their 30s, it starts to linger a little longer and you start to get like tendonitis. The tendon structure starts to break. So they feel it for a little longer. And then in their 40s, it's like it starts to give. So it's just time under tension for men specifically. And then for females, as women age, osteoporosis, osteopenia, those are things you have to look at when you get above 40. So it's just an overlying principle. It's not saying that everyone's going to break down above 40, but these are just some certain things that we see in the clinic at Iron Health.
Right, that we just see an uptick of patients around that age. So, yeah, today we're going to be talking about why it's important to stay active over 40. That was a great, I didn't even know that, especially for men's health. I did specifically for females. I know that our bone density starts to decrease after the age of 35. Um, Personally, for me too, I've seen that postpartum, especially, just the decrease in bone density and how fragile our bodies start to get as we get older. And just being proactive and taking care of them is huge. And so today we'll talk a little bit more about the different components of staying active and healthy over 40 and what those look like. So, what is one of the biggest things that you think is important for being active over 40?
Yeah, I think once you're starting to get over 40, you have to really pivot your mindset to just from being like strong and pushing weight or exercising aggressively. You can still do those things, but I think mobility is a big factor when you start to get above 40. And when I say mobility, it's not just, hey, I'm going to do yoga and stretch my legs. Mobility is, are my joints moving correctly? Because all your joints have like a certain amount of lubrication in there that we need to keep moving so you prevent arthritis, you prevent the wear and tear. Think about your shoulder again, for example. I use the shoulder because it's one of the most complicated joints, but it has a lot of degrees of freedom. Like, are we putting it through its end ranges of motion to make sure that the joint stays lubricated? So mobility to me is one of the big key components when you start to get above 40. And
Can you give an example of mobility movement that might not seem like they wouldn't seem like mobility to somebody? Do you know what I mean?
yeah,
Like, I think people, to your point, would be like, oh, yoga and stretching, but like, what's a movement that they could be doing that would be what you're talking
well, I'll
about?
talk about like an everyday thing that could be happening that may classify as like lack of mobility if you don't have it. And I've seen it a lot as an example is like someone going to reach their seatbelt, right? If you go and pull your seatbelt across your body, that requires mobility. It's not much in the arm, but it does require certain mobility. And you wouldn't know how many people I come in that can't do that or are starting to have pain when they do that. We take those things for granted, but that's a little thing on a daily basis that requires mobility for you to reach across your body to pull a seatbelt in. So something like that is essential. And now if we compound that on like what is the mobility requirements, like if you look at the shoulder, like I said, it's a ball and socket joint, which just means that it's literally like a ball and then a socket. And it means it can rotate freely, like a lot of degrees of freedom, we call that. So if you think of like everyone was young, they did arm circles. There's ways to do arm circles that actually enhance the mobility of your shoulder to make sure lubrication is happening appropriately. So something that simple can drastically improve the mobility of your shoulder. Now, in this setting, we're not going to get up and show examples of that, but that's kind of a basic one for me. Think of each joint as its own world. Like each joint has synovial fluid. The bone meets the bone. There's ligaments. There's everything happening there. If you don't get each joint moving appropriately to n degrees of motion, that's when it starts to get cold. That's when it starts to wear down. That's when you start to like get restricted in range of motion. Like another one would be Can I sit on my heels, right? That's a lot of knee mobility, a lot of quad flexibility. There's a lot of requirements there, and these small little basic things are so important. So having like a mobility checklist as you're getting up in age is important, and you don't need to just train mobility. That's not something we're saying, but you have to have that an active component when you're getting above 40 to make sure your joints are staying healthy, because joints take all the load. And, to your point before, as you age, I always say gravity wins. As we age, gravity's going to keep pulling us down and down and down and down. There's a lot of different stresses on our joints, a lot of different ground reaction forces from the ground, and that's what starts to stress your joints and wear them down. So we need to make sure we're counterbalancing that in certain ways.
I like how you said like each joint is its own world. Like that was such a good visual for me, and it's huge because another factor of being active over 40 is strength. And if you don't have the proper mobility, then you're more likely to get injured because your body's not going to those end ranges of motion, and then that's when you can pull something, you can herniate something. Like you can definitely do some damage if you don't have the proper mobility. So it's not, just like you, to your point too, being intentional and not just going through the motions. Like arm circles is a great example, and making sure you're doing it slow and controlled. I know that this is something that we do when people come in for our little like just discovery visits, right? Like you basically want to make sure that if you were to take somebody through an arm circle, it's done intentionally. You're going through the full range. It's super slow and controlled. You're hitting certain rotations and whatnot, and you're not just doing arm circles to do them. But the point is that you want to make sure that you're focused on mobility first and foremost. It's not just, oh, let me just check this off the list, and you're doing it kind of just to go through the motion, no pun intended. You want to do it to actually do it so
Yeah, for
that you
sure.
can improve your strength gains as you get older, and that's huge for anyone over the age of 40.
Yeah. I mean, well, I think strength will be the next thing we'll talk about, but on that mobility point too, Alina mentioned something like when you come in to our office, we do like an assessment. Like there's some certain basic check marks you need to hit with mobility. Like when I have anyone who comes in for a PT assessment, I'm looking at just basic overall mobility things you should be doing. Like, does your hand, when you reach it behind your back, touch your opposite shoulder blade? Can you do that? Can you touch your toes? Can you rotate and see the opposite shoulder in a mirror? Like, there's basic components that you want to make sure you have in mobility. So, like, you don't you don't it's like you're on a car without a tire, right? Like you want to make sure that you're efficiently moving. Like you wouldn't believe how many people I see. It's like, hey, rotate to the left, the motion's good, but then rotate to the right, it's stiff. And then they're like, yeah, I'm in the gym 5 days a week, squatting heavy and benching and box jumps. And it's like you're feeding asymmetries at that point. So that's why the mobility is so important, because if you feed asymmetries, you'll see that one side of your body starts to break down before the other as well. So having a mobility kind of checklist and making sure that you hit the bare basics of mobility and then you keeping those joints healthy is key to making sure as you age you can do this forever and not just till you're 60 and then you're done drinking beers.
Yeah, you can still drink beers as long as you're active.
You drink the new beers, the Michelob Ultra. It's 2 carbs.
Okay, don't really. um, so next up, you would say strength.
Yeah,
Why is strength important?
yeah. I think again, two components. One, when you're above 40, gravity's got 40 years on you. It's starting to win. If you had a sedentary lifestyle or desk job, like gravity's winning, right? So muscles are elongated where they shouldn't be, they're shortened where they shouldn't be. So we need to counterbalance that in a certain way. So you have two components when you look at strength to me. When you're above 40, the first component is, do I have isolated strength? Right? Are my rotator cuffs firing appropriately? Are my little muscles firing appropriately? Are they working efficiently to keep my body the healthiest it can be? If they are, then you have functional strength, which I know, in Iron Health, that's a big focus of our small group training is like, can I be functional with the strength that I do have and make sure that I'm getting stronger, staying strong, giving my joints the appropriate amount of tension to make sure that they stay healthy. Those are kind of the components of strength. Don't let gravity win. That's like my big overlying principle there.
I would also say like, and maybe you're saying the same thing, just differently, because you mentioned you're feeding asymmetries at a certain point without proper mobility. So focusing on unilateral movements, and I don't know if that's considered isolated strength for you, or if you're talking specifically like about a joint versus movements, but the unilateral component being like you're focusing on training. You are isolating, I guess, yeah, because you have to
You're isolating. I completely agree. I was talking about more of like specific muscles, but I do think, I see ton of people that come to me that are in the gym or into fitness and they're working out, and if they're not even if they're above 40, but usually if they're above 40, it's like you need to be doing unilateral stuff because you need to make sure that you're not feeding one that's weaker versus the other. And like, for example, I'll use me, like my left arm is really disrupted compared to my right. So I have to do unilateral stuff, which is one arm at a time to make sure that this strength is is maintaining and it's not just this one doing the work, right? That is important component of fitness when you're above 42. I 100% agree.
Cool.
So, like, if we look at strength, it's like, do you have isolated strength? Do you have unilateral strength? And now, do you have functional strength? Can you carry those three things going forward when you get strong? And obviously, the end of the day is like, you just don't want to get weaker, right? Like, don't let gravity beat you. Like, you need to make sure you're putting muscles through a certain amount of load so you can develop strength, and then keep fighting off that, the gravity component and feeding these asymmetries of sitting all day, doing nothing, getting your muscles tight, right?
For sure. I think, another big component of, unless you want to touch on anything strength based more.
The functional strength component we can really go into, but functional strength really correlates to your life, right? Like if you go pick up laundry, you go pick up your kids, like you carry groceries, that's all functional strength. So you want to make sure you're doing things in that functional strength category that carry over to something you're doing in normal life, especially when you're above 40, right? Like if you're not a bodybuilder or a power lifter or something like that, like you need to be functional so that you can live a life without potentially having pain or going down a rabbit hole of being injured.
I'm actually curious, what are like, you said shoulders for men, but like, what are some other big injuries you see a lot? I feel like I've seen a lot of male patients getting knee replacements and a lot of females with hips.
Yeah. I don't know the specifics on hips and knees for men and women.
Yeah. What's just a common injury that you see a lot?
I mean, back pain's the number one.
Okay.
You see back pain all the time. And traditionally, like if I had to put people in a bucket, and this isn't common for everyone, but usually men get back pain because of the lack of mobility, and females get back pain because of the lack of strength.
Okay.
That's traditional the way it is. Doesn't mean everyone falls into that category, but I know like if I have a guy with back pain and I screen his joints and they're not moving correctly, it's a correlating factor to why he's getting back pain. Where a female, if I'm looking at their back pain, unless they're a lot older, it's like, are your hips strong? Is your core engaging? Do you have too much mobility? Like I think if another perspective of that is like a gymnast, like they have so much mobility. It's like you need to stabilize and get them strong to make sure that they don't get back pain.
You don't like, I feel like gymnasts are so strong.
In certain movements, yeah. But a lot of times, like, I know we're going on a tangent, but gymnasts have a lot of backward extension.
Mm,
So you see a lot of fractures, and their spine moves too much.
okay.
So if I will say, like, for that specific population, a gymnast or a cheerleader, if they're already hypermobile,
Mm-hmm.
that's a harder rehab because you have to stabilize them. And they were so strong already, it's like you have to throw small movements at them to stabilize them appropriately.
Yeah, they probably
Totally
have like
different animal.
crazy core strength, and then their back is a lot weaker compared to their
Exactly.
core. But you said something that we're going to transition into the next component of aging over 40 and making sure that you are doing that, staying active properly over the age of 40, and that is stability. So, why is that important?
Yeah, I think stability is just to put it in big picture, what is stability? Stability is your body's tendency to stay stagnant with movement. So, let's say for example, like a basic plank, like that's true stability. You're not moving, you're in a position, you're increasing endurance, you're making sure you're firing the muscles for time under tension versus like a lunge where you're actually moving and developing strength. So, stability is so important because we need to make sure like as we get older, especially over 40, like do our small muscles fire when we're standing on one leg to keep us stable so we decrease the risk of falls. Is our core have endurance, so if I'm walking or standing for a long period of time, I just don't have back pain because my core can't hang on, right? So making sure there's a stability component as you age above 40 is super important. And then, that stability and mobility go hand in hand. It's like I'm training mobility, but now I'm gaining motion. Like, let's take example the hips. The hips are similar to the shoulder, multiple degrees of freedom, ball and socket joint. If you gain mobility in them, right? Now you've freed up a lot of the tight muscles, the joints moving appropriately. Now you need to get the muscles to fire to actually make sure it stays there. So like having that component of like we're going to increase stability, so all the work we did in our mobility aspect is protecting us and staying there rather than getting worse.
I mean, so far, all of these things totally play into each other. And I'm sure there are people that have maybe one component and it's really just focusing on one or two of the other ones that we're talking about today. Or maybe there's people that don't have any. So, what, like, mobility is the first that they would really focus on, or what would you say? Would it be like individual to the person?
I think it's very individual. So you want to align yourself with a good team, a good coach who's going to help push you and understand your body to then adjust your programming for that. Um, I would say, this is a high level, like in anyone's program who's above 40, they should have certain aspects of all of these components, right? It's just you don't want to just be a one-shot pony. Like obviously, if you have pain, you need to be going into PT or something to address it a little deeper. Obviously, above 40, you do want to make sure your joints are moving appropriately. So I mean, that's your base level of it. Like you need to make sure you maintain mobility as you get older, so your joints don't start to wear, you don't start to get arthritis, you don't start to get um, disc herniations. Like I think about when we go into the other category of people above 65, like people with stenosis of the spine, like that could have probably been prevented in their 40s, like if they regain the appropriate mobility, stability, and the strength.
That's crazy. It's 25 years like sooner,
Yeah,
and that's where it starts.
that's where it starts. That's why being above 40 is like it's not the end of a life, but you have to make sure you have these components in your fitness regimen so you're not kicking the can down the road to when something else bad can happen.
And you also mentioned that for men, if like shoulders are a big thing, it starts in their 20s. So that's a trend, right? Like, what am I doing now that my 20-year-old version, 20 years from now version of myself would be thanking me for or cursing me for in that same breath? Like, is there something that I can be doing now that in 20 years from now I'll be benefiting from or that will be harming me? Are there any other things that somebody that is staying active over 40 should be looking for, considering?
Yeah, I think those three things are like your base level, right? Like mobility, strength, and stability. The next level is really progressions, right? When you're 40, it doesn't mean you can't get stronger, you can't progress. Because the key of this, like any sort of fitness regimen, is to make sure that you're getting better, not worse. So having an appropriate progression atmosphere is important. So if you were to coach at Iron Health, or to PT, like making sure you're being progressed. If you do the same thing every single day, no increase in resistance, no increase in reps, no increase in time, you're not progressing. So you're just maintaining. Like maintenance when you're above 40 is not the ideal situation. You want to make sure you have a goal and you go after it. Um, Now, obviously, it's a top level of this. You don't want to progress if your mobility is really restricted. If you need to spend more time on mobility, you do it. But progressions are so important when you're above 40 because you don't want it to go the other way.
But you can progress with mobility too, even.
Yeah, you can. I
Yeah.
mean, I mean, there's people out there who do straight mobility training that can be very intense, and that's the only thing they do. And I'm not saying that's all you have to focus on, but you can progress in everything. Yeah.
Yeah. You just, your range and what your range looks like and stuff like that.
Yeah, everything.
Yeah. Great. What else would you add?
I would say too, when you're above 40, like consistency is key, right? Like a lot of people, they get older and they do less. And I think that's a mistake. Like with modern medicine, the way we're moving, the way things are going, you don't have to stop. It's like the beginning when you're at 40, and just having a clear picture of what you need to work on and being consistent with it is going to be key. Um, have a community, to help you be consistent. Have an accountability coach. Like, do not stop. Don't think like, oh, I'm 40, it's the end of the road. It's like, no, I could continue to push through this.
Just to go off of that too, with modern medicine and that whole idea, a lot of people I find will just rely on that, whether it's like a weight loss goal or, oh, I'm going to get a cortisone shot because there's pain in a joint or something. And I'm not knocking those things at all because they're here, you can use them. But don't just rely on that. Like, you still need to move your body. Your body is meant to move. We're here to move. Like, our bodies are designed a certain way. And if you're not moving, even if you're healthy and you have a good, like your weight is managed well and you have proper nutrition, you need to move your body in order to prevent injuries and everything. I'm smiling because I'm thinking of my grandma. She's 101 and her mind is starting to go, but like she every single day she will go downstairs and do her exercises, and they're just like, heel lifts, leg kicks, like in different directions, and like she's just resilient. Her body is just she's not progressing there at this age, but like just moving her body right now, I think that's what keeps her going. So that's huge. You definitely don't want to just rely on quick fixes or things that are going to help. They're not going to necessarily improve your situation. You want to continue to move your body. That's going to be really important.
Yeah, and I would think, anyone out there who's 40 or above and you're in pain or you're like, I can't start fitness, I'm too old, like get that out of your mind. A lot of it's a mindset of how you want to be. Just know that like that could be the start of your journey. 40 plus, it could be the start. Don't put a stop on it because you're above that age. Just start now and your body will thank you in 20 years.
Do people tell you that when you treat them? Like, oh, I'm too old to start that,
Yeah, of course.
and they're 40?
Yeah, you see it. Like I'm above 40, it's the end of the road. Like a lot of it's a mindset thing.
I feel like I haven't seen that,
I
but
have.
maybe because I'm on the fitness side where people are like, let's go,
Yeah.
you know?
Yeah. So mindset's so important with this aspect, and these are certain things like you want to keep being active. Like, I mean, I even think about a story of people who love tennis and it's like, oh, I'm gonna get a hip replacement. It's like, okay, great, you're getting a hip replacement because you want to play tennis again. Let's get you there. Like, you don't have to stop. Like, we're gonna make sure we push you to the right direction so you can keep on going. At the
Hmm.
end of the day, that's the name of the game. Like, you do something to make sure you get back to doing what you love, and don't let anyone tell you that you can't. Right?
Awesome. If you are somebody who's over the age of 40 and you're either looking to start getting active or continue to stay active, doing the things that you love, whether that's a physical sport or just enjoying time out in nature with family, friends, loved one, or whatever it is, like whatever activity you love doing, Iron Health, we can help you to stay active over 40 or even start getting active. Like Joe said, it's not the end of the road, it's just the beginning. And, with modern medicine, our life expectancy is longer than it ever has been. And so might as well make the most of it. So
It's
we're here to
great.
help.
Thanks, guys.